Here at Midwest Dental Arts, we always strive for perfection. So I'm going to start picking the doctor's brain to see what would the ideal dental lab would be. I'm here with Dr. Weerasooriya, and today I'm just going to pick his brain to see what should a great dental lab should be doing. Probably I'm throwing ideas. Should we do an immediate wax up right here? Should we have better communication? Should we bring our whole lab in a truck to do all this type of cases? So Doc, please let us know what we can do best to support you.
Luis, thank you for that great introduction. And I kind of like that whole idea about bringing the whole lab in a truck. We're gonna talk more about that.
Probably, it can work for some doctors, and it's something that we can, actually think it to make it better for you guys.
No, that's intriguing.
But another thing that probably you can think that it has been a trouble through this last time.
That's a great question, Luis. And so this is my 30th year in practice. And so over that really long period of time, Luis, I've had the opportunity to work with many labs. And for me, there's really one criteria that separates a really good lab from a great lab. And what's interesting is there's a lot of people out there, laboratory-wise, technician-wise, ceramist-wise, who are really good at what they do. But for me, especially when you start talking about the complexity of cases that you're doing, that Midwest is doing, you're dealing with patients, you're dealing with the general dentist, you're dealing with the surgeon, the laboratory, and then often reps from different implant companies who are trying to put together all the parts and all the pieces that we need for complex cases. Communication, Luis, for me, that's where it's at.
Do you think us coming to you guys personally in these appointments with the patient is a benefit for you?
Absolutely, Luis.
Nice.
No question. I think it's great that there's that interaction between your team and the patient, because that adds another layer to the relationships that we're building. And I think you guys do a great job of building trust with the patient as part of the team. Secondly, from a standpoint of me as a general dentist, the conversion process, I think, has always been a part of this hybrid immediate process that always is a little bit unpredictable. And
Exactly.
Amazingly, your process takes a majority of that away. And from a standpoint of what I go through, really lower stress. I think we get a better end product. The patient gets a better end product. And the entire process that the patient goes through during a conversion, completely different than before. It is very patient-centric. And at the end of the day, I think it's what we all want. We want our patient's experience to be as amazing as it can be.
And my last question, if you would think something crazy outside the box, what could that be that it could be a plus in the future, looking forward on doing any type of restorations in dentistry?
Wow. So that's another great question, Luis. I think if we're talking about hybrids and immediate hybrids in the workup phase, I think it would be interesting to be able to very quickly chairside, as we're beginning the process of talking to the patient about where we can take them, of somehow being able to quickly fabricate or print a mock-up that we can either try in with the patient or visualize for them, in an actual model where we can take them. And I think that would be very beneficial in that early stages of doing a case like this.
I think probably AI in the future will help us do that. And probably, who knows, in the future, guys, there could be a hologram right here immediately that the patient can see the treatment plan that we're proposing.
Yeah, I know that sounds kind of wild, but amazingly, I don't believe
right now we have robots.
Yeah, but I don't think we're that far away from that, Luis.
Exactly.
So that's exciting.
So that's a great idea. And stay tuned, guys, because I'm going to be asking a lot more doctors what they think the future will look in dentistry, and of course at the dental lab.